Let's go. Drew. All right. What is going on, you guys? Janae, welcome. Hello. Ba-ba-ba-bam. How is everyone doing this fine Tuesday? Barbie doll day. Janae. Let's go. What's everybody up to? We ready? Geisha, it has been a while. How have you been doing? It has been a minute. Okay. Love it. I wish I had gone to the gym today, but I didn't. So good for you. Taking care of your mind, body, and spirit. All right. Hi from PH. Where? What? PH. Is that the Philippines? Geisha, I just scheduled my NCLEX. Awesome. I know it is. It's nerve-wracking for sure, but that's the first step. All right. Nerves are normal. They are very, very normal. But if you go in it with a plan, you put in the work, you're going to be nervous, but you'll be ready. Okay? Yeah, love to see the positivity in the chat. So, today, we've got, 40 some odd people here. We've got 3 to 4 more minutes here. So we are going to be going over some question strategy today. And some of you may have been a part of this type of live before, but I feel like it is very valuable in order to help you guys reframe how you think about these questions, okay? Because they are not all that hard once you break them down piece by piece, bit by bit, okay? There is a method to the madness. And if you understand the method, the questions don't seem as intimidating or overwhelming, okay? So we will start here in just a little bit here. Do you create questions for onco also? I'm guessing that's oncology. Not specifically. I just do some general med search questions. Tamia, taking your NCLEX tomorrow. Amazing. Tamia, good luck. Everybody wish Tamia good luck in the chat. If you haven't already, Tamia, I have an NCLEX playlist. Okay. Go to my profile, go to the NCLEX playlist, watch. I think it's like the second to last video on there. All right. And I'm wearing a red shirt in the video, in the thumbnail. Check that out. All right. It's just a little bit of motivation for tomorrow. Okay. So check that out. If you guys are just getting in here and we are getting started, please go ahead and share the live down here. It's the little arrow. All right. And we can get some more folks in here before we jump off. Emmy, hey, what's up? Agatha. All right. Good to see you guys. Thank you guys for sharing the live. Much appreciated. So we are going to be getting started here. First couple minutes. Are there any wins? What do you guys think is going well? All right. Are you feeling more confident while you're studying? Did any of you take the NCLEX and pass? All right. Look at that. Hold on. We saw since learning action, I feel too confident. Oh my gosh. I love it. All right. Petra says my exam's the 21st. Wish her luck. Everybody wish Petra. Give Petra some love. Kiki, come on. I wasn't going to say anything. But it's your boy's birthday. All right. There it is. Yeah, it's your boy's birthday, and I'm here in this lovely hotel room. All right. Awesome. Thank you guys. Yeah, what do we think of UWorld? UWorld, personally, is what I used when I passed, but let me tell you this. Anybody can pass with any of these resources, okay? Anybody can pass with any of these resources, okay? Archer, UWorld, Simple Nursing, whatever the hell, okay? You can pass with it, okay? What helps is a consistent plan, all right? And that's one of the things that I offer is a study plan. Some of you in the chat have the custom study plan, and that's great, okay? So if you're interested and if you're interested in a custom study plan and your NCLEX test date is give or take more than 2 weeks away, go to the link in my bio, click get a custom NCLEX study plan, all right? Fill out the form, and I will get that study plan back to you in 1 to 2 days, okay? 1 to 2 days, you will have a custom NCLEX study plan. You can check it out in the link in my bio, all right? But as one of our lovely friends said, the action strategy listed right here on this board is, I think it's a game changer, okay? It just reframes how you look at these questions, all right? So we will get into it here. Any other wins that we can celebrate? Khaleesi, it's $25, $25, okay? And it breaks it down for you. Yes, thank you guys for the happy birthday wishes. Steek, thank you for the follow. If you guys haven't followed, you can already follow, I believe, somewhere up there. We do these lives 3 times a week. The next live is going to be on Friday, guys. Okay, mark it down. I know a lot of you set alarms for my lives, which is great. Thank you. So Friday is the next live, 9 p.m. Armageddon says my wife is sitting for NCLEX tomorrow morning. Good luck to her. Tell her to go to my NCLEX playlist on my page. Scroll all the way down to the bottom. There's a nice motivational video there for Venus. The scotch is not as frequent as you think, okay? All right, you're going to make me look like an alky. I'm not. All right, the scotch is like a once or twice a month thing, okay? So don't let the people get the wrong idea. All right, how many on here supporting the nurses that are striking in New York? Yeah, I mean, you know, if you got unsafe conditions and you're part of a union, you know, I guess that's part of it. Pittman, awesome. Getting ready to take your NCLEX tomorrow. Let me know. Guys, when you take the NCLEX, DM me. DM me afterwards, 2 days after, whenever you get your results. Let me know how it went. I want to know. I'm invested, okay? All right? I want to know. All right. Venus says, mine's is Tuesday. All right. Tuesday the 20th. Mark it down on the calendar. Venus is taking the NCLEX on Tuesday. All right. Hannah. Hell yeah. You got lots of love going on in here, guys. All right. And I promise we are going to change it. We are going to, if you're not feeling confident, we're gonna get you confident. Okay? We're gonna get you confident. We're gonna go over action, and we're gonna specifically talk about I right here. Okay, identifying the question type. Because if you can identify the question type, it eliminates half the BS in the answer options. Okay? So, if you guys don't already have a paper and pen at your side, I'm going to give you 90 seconds to go ahead and grab that, okay? So grab a piece of paper, grab a pen, okay? Because eventually I'm going to have to swap this off the screen, and it's not going to be there, all right? But it'll be up there for the next few minutes. So grab a piece of paper, grab a pen, and let's talk. Everybody drop a number 1 in the chat when you are ready. All right, and when I am just overwhelmed by ones, we're going to get started. All right? So let's go. And if you're ready, I would so freaking appreciate it if you would share this live right now. If you would share this live right now, all right? It doesn't cost you anything. Just share the live for me. Let's get some more folks in here, all right? So All right. Thank you guys. Thank Chuchi for reposting. All right. Thank you guys for the follows. Joanna, thanks for sharing. Emmy, thanks for sharing. All right. Chelsea says, test tomorrow. You got this, Chelsea. You got this. All right. Thank you guys for sharing and following. All right. Let's get into it. Okay. So we've got a few things on the screen. Okay. If you are new here, let me know too. All right. Raise your hand. Give me a little hand icon if you're new here. All right. If this is your first time, in the chat, give me a little hand raise, okay? Because you won't regret it, all right? Yep, you're new. Hand, CC, let's go. Cleo, McKeel, Bridget, let's go. Gabby, I love to see it. All right, so we are going to start with the basics here, all right? And the basics start out with action. So if you haven't written this down, go ahead and write that down on your piece of paper because you're going to refer to it throughout the live, okay? All right, the other thing we're going to do, okay, that I want you to write down is when we talk about identifying the question type, there's going to be 4 question types that we are going to identify. And they are going to be whether the question wants you to assess, intervene, evaluate, or teach. Okay? Assess, intervene, evaluate, or teach. All right? So let's first go through action here. Okay? CG, I'm new. Fantastic. You're not in the wrong spot. Let's go. All right? Stay put. You will not regret it. Thank you guys again for the happy birthday wishes. Yes, welcome to my happy birthday bash. I brought a celebratory celly, a late night celly to keep me motivated, keep me going. All right, I had a full day of learning how to become an instructor for a class called MOAB. Maybe some of you have heard of it, Management of Aggressive Behavior, but I'll do a couple videos on it at some point. But teaching folks, healthcare personnel, security guards, PSAs, how to stay safe with aggressive patients. So that's what I'm doing my birthday week. All right, but without further ado, let's get into action here, guys. All right, so action stands for ask the last line first. So when you see a whole question there, we are going to read that last line first because it tells us kind of what the question wants from us. C, clarify in your own words. Okay, so what are they really asking you to do here? Okay, and just kind of asking it in your own words, forcing you to restate it in your own words kind of helps you understand what exactly is going on. All right, T, tag those red flags. Tag the red flags. Those words like restless, post-op day 1, confusion, newly altered, unstable vital signs, all right, hypotension, all of those things in the question, we want to mentally tag those or physically tag those, all right, as red flags. All right, basically anything that makes them stable. O, out the wrong answers. So we utilize the criteria here, A, C, T, and I, and then we look at those wrong answers. And we'd be like, well, this patient's unstable, so we're not going to be teaching them. So we're definitely, any answers we can just mark off that are like, no, I'm going to teach them, how to drain their ostomy, okay? No matter how beautiful the discharge instructions are, we are not teaching unstable patients, all right? We're also not evaluating, okay, unless there's something in the question that says, hey, we gave IV morphine for severe pain, okay, then we would evaluate in the question. We would evaluate the effectiveness of whatever intervention was in the question, okay? If that doesn't happen, we're not evaluating. So we'd probably be only looking for either assessing or intervening type answers, all right? And then N stands for nail it and move the hell on. The biggest thing I hear you guys, one of the biggest things in the chat is like, oh, Jimmy, I second guess myself, okay? Don't second guess yourself, dude, all right? Pick your answer, nail it, and move the hell on. Okay? All right. Corey, I'm glad you're here too. All right. Drop some love for Corey. Takes her NCLEX on Thursday. Hell yeah. Let's go. All right, CC, I'm telling you, second guessing is an epidemic. All right. Do not do it. Pick your answer. Move the hell on. All right. So we talked about action. All right. Let's real quickly go over the 4 types of question types. All right. Assessing. Okay. If you read the question and you do not have enough information, you assess. Okay. If the problem in the question is obvious or dangerous, you intervene. Okay. Be writing this down, guys. All right. If the problem is obvious or dangerous, you intervene. If you don't have enough information, you assess. Okay. If something already happened in the question, like I referenced a question where a patient was in severe pain and they gave morphine, the question might be evaluating the effectiveness of the morphine. Okay. In which case you're going to pick an answer that evaluates the intervention that they talked about in the question. Okay. And then teaching. Okay. Teaching answers are only for the very stable and boring. I want everybody to type in the chat, okay, stable and boring, okay? Do it now, okay? Type it in the chat, press enter. All right, teaching is for stable and boring, okay? So do not teach anybody that is not stable and boring, okay? So people love to pick teaching answers when their patient is circling the drain. Okay, we're not going to do that. So good job. Thank you guys for participating and doing that. All right, love, love, love. All right, we're going to do a couple quick examples here. All right, and in these next couple examples, I'm going to read a short question about a patient, and all I want you to do is tell me whether you are going to assess, intervene, evaluate, or teach. Okay? That's all I want you to do. So I'm going to read a couple different patient scenarios here. You tell me. You can just answer A, I, E, or T. Okay? Assess, intervene, evaluate, or teach. Let's go. All right. A patient with COPD is on 2 liters nasal cannula and the O2 drops to 84%. The question asks, what should the nurse do first? Assess, intervene, evaluate, or teach. Assess, intervene, evaluate, or teach. All right. Guys, we are intervening. We are intervening, okay? We have a patient that's now becoming hypoxic. We need to do something about it. We have the objective data. We don't need any more information to tell us that they're not oxygenating well. Okay, so we're not going to pick an answer that further assesses them. We're not going to listen to their lungs. We can see on the monitor they're 84%. Okay, we need to intervene. We need to maybe sit that patient up. We need to maybe turn that oxygen up a little bit more so that that COPD patient is getting closer to 90%. All right? Yeah, exactly. Chelsea, yeah. Teach them about, and not teach, have them do, because we're intervening, have them do some pursed lip breathing. Absolutely. All right? So we intervene. All right? We don't need to assess this patient. We need to intervene. All right? So we have an unstable patient. The problem is obvious and dangerous. We need to intervene. Okay, we don't need any more data. All right, thank you guys for following. Thank you guys for sharing the live. Much appreciated. All right, next one. The nurse starts a blood transfusion. All right, 15 minutes in, the patient develops chills and back pain. The question asks, what is the nurse's priority action? All right, are we assessing, intervening, evaluating, or teaching? All right. The question is, nurse starts a blood transfusion. 15 minutes in, the patient develops chills and back pain. What's the priority action? All right. Again, All right, so we can determine that the patient's generally, I would say, unstable, right? Okay, so do we have enough information to act? All right, yeah, I would say we do, so that we need to intervene. All right, because what's going on with the patient? All right, we need to intervene. We need to stop the transfusion. All right, keep the IV line open with normal saline. All right, and then assess and notify. Okay, so they're having some sort of transfusion reaction. We can see that. We don't need to assess further. We need an intervention answer. We need to stop. Okay, so let's do another one. Okay, a patient with pneumonia has a new fever and increased heart rate, but the question does not give blood pressure, O2 sat, or mental status. Okay, it asks, what is the nurse's first action? Are we assessing, intervening, evaluating, or teaching? All right. Beautiful. We are assessing. Okay, you don't guess. Okay, you gather. Then you act. Okay. All right. Everybody clock it just a little bit if this is making sense. Let me see it in the chat. Go ahead. Pick the clock it fingers and let me see it. There's you go, Gemini. Hell yeah. Let's go. Is this making sense? All right. Because you can read a question and be like, are they stable or unstable? That should generally be the first question that you say to yourself. Is this patient unstable or stable? Okay. If they're unstable, you're not usually evaluating and you're not teaching. So you're either assessing or intervening. So if any of the questions are not an assessment and not intervening, you can throw them out. Okay. So if you need more data to answer the question and the problem is not obvious and dangerous, then you assess. Okay. So there you go. All right. Thank you guys for the follows. If you haven't followed already, you can do that up here. We do these lives 3 times a week. Usually one live a week is a question strategy live like this. All right, let's do one more of these. Okay, and then we will jump into some other questions. All right, the provider prescribes furosemide, all right, for the patient that has crackles and edema. The question asks, which parameter is most important to monitor? All right, which parameter is most important to monitor? Are we assessing, intervening, evaluating, or teaching? Are we assessing, intervening, evaluating, or teaching? All right, guys, again, so if you are evaluating means that you're evaluating the effectiveness of an intervention. And it just says the provider prescribes furosemide. Okay. Which parameter is most important to monitor? It's not really asking how do we identify the effectiveness of the furosemide. Okay. This is an assessment. We need to assess. We're not evaluating, we're assessing. Okay. If the question said, something about, okay, how can we determine the effectiveness of furosemide in the patient, then that answer would be an evaluation. It would be an evaluating answer. It would be, oh, they've had increased urine output. Oh, they've had decreased edema. They've had decreased crackles in their chest. Okay, that would be an example of an evaluation answer. All right, but this here we are assessing because we need to assess things like blood pressure, potassium level, right? Because that potassium is just peed out, blood pressure, urine output. So we need to assess those things, okay? The key is you are collecting and monitoring data to keep them safe, okay? All right, so I think what I wanted to do here is I wanted to do some case study practice, all right? Applying action, okay? So I am going to, if you, please, I'm going to get to my spot here. If you haven't already written this down, go ahead and write this down. Okay? All right. And give me a thumbs up in the chat when you are ready to go. All right. Give me a thumbs up in the chat when you're ready to go. All right. I'm excited. Are you guys excited? Let's go. Let's freaking go. All right. Who wants some case studies? All right. Who wants the case study? Okay. And remember, case studies are broken down into 6 questions, 6 different questions. Venus, don't try to make it weird. Like I'm being too much right now. All right. All right. So awesome. So, yep, she said, I hate those questions. Let's go. I joined late. Can you please? A is ask the last line first. All right. It just is a different way of reframing the question so that you understand what the question wants of you. All right. So, if you guys don't already have this either, in the link in my bio is the NCLEX Vault, which is currently free. Okay. All it requires is your name and email. And all of these strategies right here that we're talking about are listed in that resource. Okay. There's a whole tab called the Strategy Corner, okay, of the NCLEX Vault. All right. Action is there along with strategies on how to answer every single type of question on the NCLEX. All right. Case studies, bow ties, drop downs, whatever the hell. Okay. It's all there in the NCLEX Vault. All right. If you want a custom study plan, that's the option above it. All right. So let's jump into this. Okay. So each case study is 6 parts. Let me just get a couple of things off of here. All right. I see some people are over there subscribing to the Vault. Love, love, love. All right. So this is going to be the first part 1 of 6 of this very first case study. If you guys need to, go ahead and screenshot these so that you can look at them later. All right. All right. You can look back at them, make notes while we talk. All right. So we are going to talk about Mr. Alvarez here. All right. Good old Mr. Alvarez. So here's the question. Here is his situation. We want to know which new finding requires the nurse's immediate follow-up. So, guys, if we utilize action, okay, because I know you all wrote it down, okay, we are going to ask the last line first, okay? So, basically, if we ask the last line first, they want the most urgent new finding, okay? All right. So and then for C, we clarify in our own words. So which change could kill him fastest if I ignore it? Okay. Which change could kill him fastest if I ignore it? And then T, we're going to tag those red flags in the question. Okay. New hypotension is a perfusion emergency. All right. So we are going to tag those red flags. Then I. Okay, identify that question type. All right, but I see you guys trying to answer the question. But tell me first, are we assessing, intervening, evaluating, or teaching? All right, which is the answer here? Are we assessing, intervening, evaluating, or teaching? The question is, which new finding requires nurse's immediate follow-up? Okay, intervening means we're doing something. Okay, we're not doing anything yet. Okay, we are assessing in this question. We are assessing. So if you got assessing, all right, good on you. All right, give me a little emoji in the chat if you got assessing. All right, we are still assessing this patient. Okay, the answer is C. Okay, we are assessing. We're not treating yet. Okay, you need to pick up the cue that demands action next. Okay, so we outed the wrong answers. All right, fever and white blood cell count are expected in an infection. A mild SpO2 drop is important, but not the biggest immediate threat here, right? And then so N of action is nail it and move on. And that's hypotension. All right, so we're nailing it and moving on. So commit this to memory here. All right, the next part's going to build off of this one. All right, so part 2 of Mr. Alvarez. All right, part 2 of Mr. Alvarez. All right, I'm actually going to pin Emmy's comment there so you guys can see what action stands for. Okay? All right. I think it'll stay there for a little bit. All right, so part 2, again, we just follow through with action. Okay? Ask the last line first. They want the most important next data. Okay? C, clarify in your own words. What number tells me perfusion's failing right now? Okay? And then T, tag those red flags. Hypotension, confusion, low urine output. Okay? Then identify the question type. Identify the question type. Are we assessing, intervening, evaluating, or teaching? What are we doing? Assessing, intervening, evaluating, or teaching? Tell me in the chat, guys. Don't pick the answer yet. Tell me assess, intervene, evaluate, or teach. What are we doing? All right. Yeah, guys. So we are still assessing. Okay, you are collecting the most meaningful evidence right now before the next move. All right. So now we have to out the wrong answers. Anything that's slow, indirect, or diagnostic only gets cut. Okay, when the patient is unstable. Okay, so N is for nail it and move on. And so we are picking lactate here. Answer is A, all right, because your lactate is the perfusion receipt. Okay, it gives the best idea of what is going on with the patient. Okay, so if you're just jumping in, we are doing a case study. This is the second part of the case study. All right, basically, we are moving on here to part 3. We are moving on to part 3 of this case study with Mr. Alvarez. Okay, so read this and go through action. Yeah, Chase, normally there will be a SATA or 2 in these case studies. However, for my purposes right now, I am not doing that because I'm trying to drill something else into you guys right now. All right, it's kind of hard enough to understand what we're doing. So I did not include any SATAs in these case studies. All right, so part 3, guys, continue with action. I'm telling you guys, look at the freaking piece of paper at your side and go through action. Okay, ask the last line first. They want the best explanation. Okay, clarify in your own words. C, what diagnosis connects infection plus shock physiology? All right, then T, tag those red flags. Lactic's up, BP's down, mentation's down, urine's down. Those are all red flags. Then we identify the question type. Are we assessing, intervening, evaluating, or teaching? We are still assessing. This is an assess and interpret. We are not treating, right? We're identifying what the thing is. Okay, we're assessing and interpreting. So now we owe out the wrong answers. Okay, so choose the condition that explains the whole picture. Okay, we're just putting this puzzle together now. All right, so we're putting the whole puzzle together, not just one feature like crackles. Okay, then N, we need to nail it and move on. So which is it? The answer is A. Okay, so septic shock fits the umbrella of all of the stuff that we've been learning about with this patient. So A, septic shock. So we have a patient that's going through septic shock, they're hypotensive, their lactate is elevated. All right, now let's go to part 4. Let's go to part 4 of the case study. Okay, yes, Her Majesty, exactly. All right, so now we have the question there, and take yourselves through action. Take yourselves through action. Okay, ask the last line. So what do they want? They want first action here. They want first action. Clarify the question in your own words. So what will keep him alive in the next 60 seconds? All right, then tag those red flags. Tag those red flags. So SpO2 of 86%. All right, accessory muscles. Can't speak in full sentences. Those are your red flags. So what do we need to do here, guys? So our patient is unstable. Are we assessing, intervening, evaluate, or teaching? And I swear to God, if you say anything about evaluating or teaching, I'm going to come through that screen. Don't do it. Chase, good. Apple of God's eye, Venus. All right, we are intervening. Absolutely. All right, this is not the time for more testing. Okay, so now we out the wrong answers. Okay, any answers that delay stabilization or worsens perfusion or treats the wrong problem has to get cut here. Okay, so N, nail it and move on. We're picking oxygen. All right, correct answer is A. All right, because the patient's unstable and hypoxemic with increased work of breathing, right? So the fastest, lowest risk first step is to improve oxygenation and ventilation immediately while continuing sepsis care. So upright positioning plus a non-rebreather can rapidly improve oxygen delivery and buys time for the next interventions. All right, if you guys are feeling, holy moly, Jimmy, this actually is starting to make sense, all right, let me know in the chat. And if it's super helpful, I would encourage you to either follow if you haven't already followed or share this live. So let's jump into, Chris, I needed to see this. Good. Chase, fantastic. I'm glad you're here. I'm glad you guys are here. Chris, thanks for the follow. All right, let's go to question 5 of this case study. So now we had our septic patient that became hypoxic. All right, we just applied some oxygen. All right, we positioned them upright and put on a non-rebreather, and now we start antibiotics. Cautious fluid bolus with frequent lung reassessment. All right, he looks less panicked. All right, so now what are we doing? All right, urine output remains over 35 mLs for the last hour. Which finding best indicates that the current interventions are improving? Yes, exactly. Good job, guys. I didn't even have to ask the question. We are evaluating, okay? Because you only evaluate when you do something in the question. When you're evaluating the effectiveness of the interventions that you performed. All right, good. Hell yeah. All right, so take yourself through action. All right, ask the last line first. They want proof the interventions worked for perfusion. Clarify then. What tells me blood flow to the organs is improving? Okay, tag those red flags. Tag them. All right, shock affects kidneys early. All right, so urine output matters. Okay, then I identify the question type. Yes, we are evaluating because we already intervened. We already intervened in the last question. Now we check the response. Okay, so O is for out those wrong answers. So we separate oxygenation improvements from perfusion improvements. All right, so now N is for nail it and move on, and urine output is a perfusion win. So the answer is B, okay? The answer is B. If you have questions on the NCLEX about how to measure improving perfusion, there's a good chance it's going to somehow relate to urine output, okay? There is a good chance that it's going to relate to urine output for perfusion. All right, let's look at the part 6. This is the final part. So Mr. Alvarez, he was septic. We gave him some oxygen. And then we hooked him up with some fluids, some antibiotics. His perfusion is improving. And now here he is the next day. All right, he's now stable on 2 liters nasal cannula. Mentation's back. Let's go through action. Okay, ask the last line first. So they want the highest priority teaching. So then C of action, clarify. What education prevents the most harm after discharge? Okay, that's what the question's asking. Then T, tag those red flags. So he has a recent severe illness, a high risk of relapse, and med adherence issues. All right, identify the question type. Here we are. What are we doing? We are teaching. Okay, yeah, each at love. We are teaching because now he is stable and boring. Okay, those are the only patients you teach. Stable and boring patients. Okay, so, great. So now, out the wrong answers. Cut out any extreme restrictions, unsafe med advice, anything not evidence-based, okay? And then N, nail it and move on. So the answer here is going to be finish antibiotics, A, right? Because stopping antibiotics early increases the risk of treatment failure and relapse, which is going to be especially dangerous for this older guy with comorbidities who just decompensated, right? All right, so this is a direct safety priority tied to preventing reoccurrence and rehospitalization. All right, how we doing? Okay, how are we doing? Like this, it's. I said, hi, I have a question. Like this, it's NCLEX real? Tell me your question again. Okay, I feel like I did good. Good. You didn't. I didn't see your question. I'm not constantly looking at the chat, especially when I'm going over questions. Bella, everything's making sense. I love to see it. Blue, seeing the light. Let's go. Seeing the light. I only missed one. Coroni followed. Let's go. All right. We do these lives 3 times a week, guys. 3 times a week. All right. One of them is always question strategy. That's what I'm making. I'm saying it now. The next live is going to be Friday. I still have another case study, so don't go anywhere. We're not done. Okay. We're not done yet, guys. All right. It will be similar, but on case studies on the NCLEX are going to have select all that apply in there as well. Okay. So don't freak out. Just treat each SATA question as its own true false. Okay. A, B, C, D. Corey says this makes it easier to break down questions. Absolutely. That's what this is about. Okay. Looking at a question and having a strategy to break it down. All right. So I incorporate these strategies on my custom NCLEX study plan. Again, guys, if you want the custom NCLEX study plan, go to the link in my bio, click get a custom NCLEX study plan, and I'll get it back to you in 1 to 2 days. Okay. All right. People are DMing me a couple times a week telling me they passed, which is amazing. So don't miss out. Check that out. They're $25. 1, 2, 3, 4, 5, 6. All right, let's jump into Miss Donnelly. All right, Miss Donnelly's case study here. Let me get some water out of my little mini fridge here. Okay. All right, so Miss Donnelly. All right, if you have specific questions about the study plan, feel free to DM me, okay? Because I apologize if I can't get to every question about it in the chat. I answer every DM. All right, so Miss Donnelly here. Let's go through action, okay? ACTION. All right, A, ask the last line first, okay? So immediate follow-up, okay, equals the most dangerous new cue here. Okay, so for C of action, clarify your own words, I would say, what change means organs aren't getting blood right now? Okay, and then T, we're going to tag those red flags. The red flags here, I would say, are new hypotension and mentation change. Okay, so that tells me that there's some sort of perfusion emergency going on. Then I, identify the question type. Okay, this is an assessment question. All right, thank you guys for the follows. This is an assessment and recognize the deterioration that's going on here. So, O, we need to out the wrong answers. Okay, expected infection cues and mild SpO2 drift lose to blood pressure collapse. Okay, so N, nail it and move on. Here, it's going to be C, hypotension wins the day. All right, because a sudden significant drop in blood pressure is going to signal impaired perfusion and possible progression to septic shock. Okay, this is an acute, life-threatening change that demands immediate assessment and rapid action. All right, there we go. So we have a patient who has a lot going on. They've received some fluids, some IV antibiotics. They're on oxygen. And let's check out part 2. Okay, part 2, Ms. Donnelly says, I feel dizzy. All right. So let's go through action again, okay? All right, ask the last line first, okay? They want the single most important next data point. That's what they're asking for. Clarify the question in your own words. Which number, I would say which number tells me perfusion's failing right now? All right, tag those red flags. What are some red flags in that question, guys? Let me know in the chat. All right, I would say things like blood pressure, right? Blood pressure's down. Urine's down. Mentation's down. Modeling, right? So now we need to identify I of action, what we're doing. Identify the question type. Okay, still assess. We are still assessing. Okay, so pick the most meaningful confirmation of shock. All right, so yes, the answer is lactate. A. All right, the answer is lactate. So similar case study here. All right. Whew. For those of you joining, we are doing a little case study practice, and basically this is part 3 of our case study, and basically we've determined that our little Meemaw is basically has been admitted for urosepsis, has gotten some IV antibiotics, is on 2 liters of oxygen, got a fluid bolus. All right. The lactate is high per this question. All right. So now we're identifying what is going on with her, right? Identify the question type here. All right. So here, the correct answer is going to be A, right? So septic shock related to the urinary source because meemaws love to get UTIs. All right, especially if they're coming from a sniff, where they have a place where never getting their diaper changed. All right, I see it, oh my God, multiple times a week because I work in the ER. All right, so we have a suspected infection, plus hypotension, elevated lactate, altered mental status, cool mottled skin, all right, and worsening kidney function. These all fit the bill for septic shock, all right, with that tissue hypoperfusion. All right, so we outed the wrong answers. All right, do not chase one detail like AFib and IMR or INR, okay, especially if sepsis explains everything. So N, nail it and move the hell on. Septic shock, okay, guys? All right. Here we go, part 4. Yes, we are now finally, thank you for the follow there, Ami. We are intervening. All right, yes. We go through the acronym, action, okay? Ask the last line first. What do they want? They want first action. So C, clarify. What keeps her alive in the next minute? That's what I would say in my own words. What keeps her alive in the next minute? Then T, tag those red flags, right? SpO2, 85%. Tachypnea, short sentences, okay? Hypotensive, those are your red flags. We see that this patient is unfreaking stable. We need to intervene now. We have to intervene now, okay? So, out the wrong answers. We're cutting anything that delays stabilization or worsens blood pressure. All right, so yes, the answer is A. All right, so guys, you should be able to read a question. This is what I want you to do. All right, that was part 4. I want you to be able to read the question, all right, and then look and think to yourself. Don't even look at the answers yet. Don't even look at the answers yet, guys, okay? Read the freaking question, okay? And then say to yourself, is this patient stable or unstable? Okay? And then determine what you're going to do before you even look at the answers, okay? Because before you even look at the answers, you can probably take out at least one of them, often 2 of them, all right? If you say, well, I need to intervene, and there's only 1 intervene answer or 2 intervene answers, okay? What would Nurse Jimmy say in my mind right now? Exactly, Chase. That's what I'm talking about, okay? I'm getting in your head, okay? There you go. All right, so read the question first, identify the question type, assess, intervene, evaluate or teach, and then look at the answers, okay? All right, here we go. Hold on. Hold the hell on. Ms. Donnelly. Okay. We did that one. We did 4. Sorry. When I took it down, I lost where I was at. All right, there we go. All right, part 5. Now she's sitting upright. We got the non-breather on. All right, she looks less panicked. All right. Good. I know that this question seems very similar to the first one, but I'm just trying to drill this, guys. I just really want you to see the pattern. All right. I really want you to see the pattern. All right. So, yes. Yes. All right. We are evaluating here. Okay. So, correct. The answer is going to be B. Because that urine output is, again, that best sign for increased perfusion. All right? When we have perfusion issues, we look for answers that indicate increased perfusion. And in this case, it's going to be urine output. All right, let's look at 6. here we go. Now she's stable. What are we doing as far as teaching goes? Okay. Ask that last line first. All right. Highest priority teaching means which one prevents the most harm. Okay. And if you were to clarify in my own words, I would say what belief could lead her back into sepsis. Okay. So we tag our red flags. Things like older adult, recurrent UTIs, CKD, wants to self-stop meds, right? So we identify that we are teaching for safety and relapse prevention. Then we out all those wrong answers being things that cut unsafe med advice or anything else promoting resistance. And we select the answer that says A, finish the full course of the antibiotics. All right. So good. All right. Let's try to sneak in one more. All right. If you're in it for one more, are you in it for one more? Let's go. Let's talk about good old Mr. Pierce here. Mr. Pierce. All right. What I want you guys to do first, I want you guys to throw out some red flags. Throw out a red flag that you see in this question. All right? What red flag do you see in this question? Anything. Blue, there it is. All right. Yep, so we got black tarry stools. We've got blood pressure issues, the hypotension, right? All right, so those are our red flags. So now we identify the question type. Is this patient stable or unstable? All right, well, they've got a lot going on. All right, but yeah, they are unstable. So we're not evaluating. We're not definitely not teaching, right? So none of these, the question and the answers don't line up to an intervention. So yeah, we are assessing. We're assessing the hell out of this patient. All right. So, beautiful. So yes, the answer here is going to be B, the blood pressure drop. All right, because any new significant drop in blood pressure in a client with an active or a recent GI bleed could signal worsening volume loss, all right, and impaired perfusion. So hypotension is immediately life-threatening and can progress to hemorrhagic shock, okay, if not addressed quickly. All right, and all those other findings may be expected or slower moving compared with perfusion decreases, right? All right, so blood pressure B, nail it and move the hell on. All right, part 2. All right, then he becomes, oh Lord, pale and says, I'm going to pass out. Don't do it, Mr. Pierce. Don't do it. All right, so let's go through action. Let's go through action. So ask the last line first. What do they want? They want the most important next data. And then if I'm going to clarify in my own words, I'll say something like, what number tells me how badly he can't clot right now? Okay? And then I'm going to tag my red flags. Cirrhosis, GI bleed, hypotension, low urine output. All right? Those are all red flags. Then I'm going to identify the question type, I. All right? We are still going to be assessing. All right? Collect the most actionable data that will guide the next interventions, right? So then O of action, out the wrong answers. All right, so don't chase any secondary diagnostics, right, when bleeding control is the bottleneck. All right, and then N is for nail it and move on. So here the answer is going to be INR, C, right? Because in a cirrhotic client with a suspected or confirmed GI bleed, the INR is going to be high yield immediate data point because it reflects impaired clotting factor synthesis and guides urgent reversal strategies and product selection. Okay, things like plasma. Do we need vitamin K? All right. The client is unstable. They are actively bleeding. So knowing the degree of the coagulopathy changes the next critical steps more directly than ammonia, ECG, or waiting on your hematocrit and hemoglobin trends, right? Someone said, what about the foul smell? No, don't worry about it. That's distracting. All right, so let's jump into part 3. We only got a couple minutes left. All right. Yep. It's foul because it's GI bleed, right? All right, part 3. Read through it and take yourselves through action. Take yourselves through at the action mnemonic. All right? Ask the last line first. What are they saying? They want the best explanation. And if I'm going to clarify in my own words, I'd say something like, what diagnosis connects bleeding plus shock physiology? Okay? Then tag those red flags. What are we tagging? Okay? We see BP down, lactic up, urine down, skin cool. All right? So here we are picking the condition that explains the whole picture. All right? We are picking the condition that explains the whole picture. And yes, it is going to be A, hemorrhagic shock. All right, related to GI bleed with cirrhosis-associated coagulopathy. All right, so the combination of active GI bleeding with that melena, those foul, dark-smelling stools, right? Hypotension, tachycardia, cool skin, low urine output, and a rising lactate fits that hemorrhagic shock, all right, with tissue hypoperfusion. So then the elevated INR and thrombocytopenia support impaired hemostasis from cirrhosis, okay, making that ongoing bleeding more likely and harder to control. All right, give me a thumbs up if that makes sense. All right, so hemorrhagic shock is our answer here. N is for nail it and move the hell on. All right, Chase got it. Teresa, Pittman, fantastic. Shaylee, love to see it. Good job, Joanna. All right, let's go to part 4 of this case study. Venus, good job. Ashley, Duty, thanks for the follow. If you guys haven't already followed, go ahead and follow up here. We do these lives 3 times a week. The next live is this coming Friday at 9 p.m. Eastern time. All right, so go ahead and follow. And I have a whole NCLEX review playlist, 32 parts on my profile. All right, it's a full playlist on its own. Check that out. If you take the NCLEX this week and you haven't watched my full playlist, go ahead and binge that. All right, I'm telling you, it will help. No video is more than 3.5 minutes. All right, take an hour, hour and a half, and just binge those videos. Okay. Black Mermaid, the NCLEX playlist is on my profile. You go to my to the little me icon right there, and then you'll be able to scroll horizontally my playlists, and I have a full NCLEX review on there. Okay? All right, so part 4. Take yourselves through action. All right? The last line to me says they want the first action, right? Clarify in your own words. What's going to keep him alive in the next 60 seconds? All right, then tag your red flags. Hypotensive, tachycardic, altered behavior. All right, then identify the question type. All right, our patient is unstable. The problem is obvious and dangerous. We are going to intervene. We need to intervene here. We need to stabilize circulation immediately. All right, now, O of action. We out the wrong answers. We cut anything that delays resuscitation or increases bleeding risk. All right, and then N, pick our answer. What's our answer? Our answer is going to be A. All right, begin the rapid infusion while preparing for blood admin. All right, so we are going to nail that answer and move on. Okay, so that's going to be our answer here because the immediate threat is what? It's circulatory collapse from volume loss. So while waiting for the blood products, we need to initiate those crystalloid fluids, all right, to support their volume, all right, their volume and perfusion, and is an appropriate bridge until the transfusion begins. All right, this is the fastest, most life-preserving action, all right, that does not delay definitive resuscitation. So good job on that. Let's look at part 5 here. Almost done here. Almost done. Again, if you guys haven't already followed, go ahead and follow. We do 3 of these lives a week. All right. Brianna, thanks for the follow. Much appreciated. All right. So take yourselves through action. Lulu, thanks for the follow. Take yourselves through action. All right. Ask the last line first. Basically, they want proof perfusion's working or improving. Clarify. C. What tells me organs are getting blood again? Would be how I'd say that in my own words. Okay. Tag those red flags. So red flags like shock. Shock hits kidneys early, so we need to watch that urine. All right. And then identify. What do they want us to do? What role are we playing? Okay. We're going to put our evaluator hat on. We're going to evaluate, because we just did an intervention in the last part of the question. So let's then out those wrong answers. Okay? Don't confuse numbers look nice with organ perfusion. All right? So, yes, our answer is going to be C. Love how I put that increased urine output is the answer for all these case studies. All right? It's important. All right, so nail it and move the hell on. All right, and then last question here, 6. Now she's stable. All right, and then we do some teaching, because we only teach patients that are what? In the chat, guys, give me those 2 words. We only teach patients that are what? Stable and stable. There it is, Chase. Stable and boring. Stable and boring wins the day. All right. Awesome. All right. So if we take ourselves through action, we should arrive at the answer of A, right? Return immediately if you have black, tarry stools, vomiting, blood, dizziness, or fainting. Okay, because the highest priority is going to be recognizing early warning signs of rebleeding and shock and seeking immediate care. Okay, because variceal bleeds can reoccur and become rapidly fatal. So symptom-triggered return precautions are going to be a direct safety priority that prevents delayed treatment. All right, how was that, guys? How was that? Was there some of you who've not attended this before? Was there like a light bulb moment here? Venus, I know you are here all the time, so thank you guys. Thank you for all the regulars who keep coming back. All right, Teresa, awesome. Chase, my normal schedule is Sundays, Tuesdays, and Thursdays, but I am traveling this week for this class that I'm doing, this instructor training. So the next live will be Friday at 9 p.m. Eastern. Okay. After that will be a normal Sunday, Tuesday, Thursday schedule. All right. So good job, guys. All right. So stay put. If you guys are looking for a little extra help. All right. So when I do custom study plans, I weave this knowledge into those plans. All right. So what I want to just show you real quick, all right, is on my page. All right. First, you guys were asking about, hold on a sec. Thank you guys for all those follows. I just need to close out these notifications here. All right. I have a whole NCLEX playlist right here, 32 parts. So check that out. All right. Then the link in my bio, when you click that, it is going to go to right here where you can click this to start the form to get your custom NCLEX study plan. All right. So you'll go in here, and basically when this loads, it will ask you a few questions. Basic, what NCLEX are you taking? Is this your first time? If it's your first time, totally fine. Like, I make these for first timers as well as for people retesting. If you're retesting, I'm going to ask a little bit of information about your CPR results. So what are you above the passing standard and below? All right. When's your test date? What resources do you have? Because this is when I tell you to do in the study plan to go do, 75 question mixed sets. I'm going to want to know what resources you have access to. All right. If you don't have resources, I'll come up with a plan. That utilizes free resources if you need it. But I would suggest having at least access to one of these question banks. All right. Then what is any weak areas that you've identified? Hey, I have trouble with fundamentals and cardiac. Let me know. Check those boxes. Then how many hours each weekday do you have the study? Is it 3? Is it 4? Is it 6? Do you not work? It's fine. Just let me know. And then how many hours every weekend day? And so when I create these study plans, it's going to give you blocks of time. It's going to say, hey, you have 6 hours on every weekend day. So block 1 is 2.5 hours. This is exactly what I want you to do in bullets. All right. It takes all of the guessing. Out of what to study and when. Excuse me. All right. Then I talked about put in your anxiety level. And then literally anything else that you feel is relevant to your situation that I can help build a plan around. The more information, the better. All right. The more information, the better. And then at the bottom, you'll pay. Again, it's $25. Okay. Blue, good question about the new NCLEX starts April 1st. So I've looked at the test plans comparing the 2023 to the 2026. There's nothing new. Don't freak yourself out. Don't fall for the rage bait on people trying to make you seem like, oh my God, there's all these changes. There's really no changes. It's practically the exact same test. Don't worry. Okay. The passing standard's still the same. There's almost nothing that's different. So don't worry about it. Do not worry about it. All right. And then the last thing over here, link in my bio, is the NCLEX Vault. All right. The NCLEX Vault is right here. You just put in your name, email, access now. All right. So when you go in there, which I'll show you here. All right. The NCLEX Vault, it starts with a little welcome page, but here are all the sections. Look at all this material. There's about 230 pages of content. All right. Probably one of my favorite sections is the strategy corner. All right. And so talks a little bit about the test itself. Then, holy moly, look at that. The action framework. Everything we just did for the last hour and 5 minutes. Okay, the action framework. All right, and then I talk about some strategies to complete and answer each type of NCLEX question. So deciding your role before reading the answers. All right, Unstable patients means no teaching. All right. Not enough information means you need to assess. Obvious and dangerous means you need to intervene. So again, all that stuff, guys, is right here at your fingertips. All the stuff that I just went over. Case studies. How to answer the case study questions. All right. And if you're a repeat test taker, you have a CPR, you're going to notice these sections on your CPR. And if you're below this passing standard on any of these, this is where those things fall in your case studies. Okay? Bow tie questions, drop down questions, the old drag and drop. All right? Some information about prior who to see first. But guys, look, also over here, under pediatrics, pharmacology, all these sections, there's also a mini test. I put 25 questions after every single subject of increasing difficulty. Okay? So that's all there. All right? And then the cheat sheets are high yield, very testable stuff that a lot of people see on the NCLEX with some mnemonics pretty much all throughout. All right? So it's all there. That's free. All right? There's literally no excuse not to jump in there. All right, so that's it, guys. That's what I got. That's what I got. So I wish you guys the best. I know a few of you said in the beginning of the live that you are taking the NCLEX this week or next week, so good luck. I'm there for you in spirit. And please, please, please let me know. DM me when you get your results. For better or for worse, let's talk about it. All right, for better or for worse, let's talk about it. But I feel like if you guys are here, you're putting in the work, and you're you're making all the right steps. All right, Chase. Yep, I'll see you Friday, buddy. I'll see you Friday. And if your NCLEX is more than 2 weeks away, check out the study plan request. All right, it's pretty in depth. All right. Joe, yeah, I think eventually the NCLEX will be online. Like, you'll be able to do it from home at some point. I'm not exactly sure when that's going live. Gloribby, you're not in the nursing program yet, but you'll be accepted. Hell yeah. Well, hey, you're here early. We're learning. That's all right. A lot of my lives they're great overlap just for general nursing school practice. All right. So good on you for being here. All right. I'm glad you're excited about it. All right. So I have an early day tomorrow. I'm going to give you guys another 60 seconds. If you haven't already, before I sign off, you can go ahead and follow right up there. Okay. So go ahead and follow. Lots of information on the profile. You'll be, if you go to my profile page, there should be a bell at the top right of my page. Like, if you go to this and then go to the top right, there's a bell there. You can be alerted to have TikTok notify you when I go live. And you can set it to only live notifications. So that's always something you can do as well if you don't want to miss a live. All right. Bella and all that were here, all 145 of you. It's been real. I'm going to get some rest because I got another long day tomorrow. Learning to keep myself safe, patient safe, and learning to be an instructor for management of aggressive behavior course. So I'll do a little bit of information, probably a video or two on that this week. All right. Yep. You're welcome, Kit. So take care, guys, and I will see you for sure on Friday at 9 p.m. Eastern Standard. Until then, I'm Nurse Jimmy.